Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone who's been living with my own chronic pain for the past 30 years. Today, I want to talk about the importance of communications with healthcare providers with people living with chronic pain. I know I've had to develop a whole new vocabulary when I was first injured because I need to learn how to communicate what I was thinking and feeling in an accurate way with my healthcare providers. Today when I work with people, there's two areas that we have to define a common vocabulary with. One is the level of their pain and the types of their pain. The other is the level of their stress. I really encourage people to learn how to use a stress thermometer because the premise is when stress levels go up, it exacerbates or worsens chronic pain. And when people have a pain flare-up, it increases their levels of stress. So the first step is using 10-point scales to teach people how to fill in each of the numbers with not just circling a number on a scale, but to give a brief verbal description of each level. So let's start with the stress thermometer scale. On a 1 to 10 scale, level 1 stress is when you first wake up in the morning. You know, before you're totally awake, you're just not sleeping anymore, but you're not up yet. That's level 1. That's in the bottom zone. The first 3 levels of stress are in what I call a relaxation zone. Level 2 is where now I'm becoming more awake, but still unfocused. And level 3 is what I call vacation mode. I'm focused here, but my focus is on relaxing. That's the relaxation area. Levels 4 and 5 are the optimal levels of functional stress. When I'm at a level 4, I'm becoming focused and active. At level 5, where I'm at right now, I'm free-flowing with no effort. I'm focused, I'm happening. You know, level 6 is the kind of day, and I'm sure many of you have had those, is when you're getting things done but you're having to push extra hard. I know that's the case for me. Okay, that's the area where when people get there, it's time to take action and pay attention. Because the next step up to level 7, we're not just dealing with psychology now, we're also dealing with biology. There's a stress reaction response, an adaptation response that occurs. At level 7, people go in and out of awareness or they become spacey. They're not focused. And when I get to level 8, that's when I become irritated and agitated, driven and defensive. And level 9 is the overreaction zone. I sometimes call this my foot and mouth stage. That's when I know I'm going to say something I know I'm going to regret, but I just can't stop it. And level 10 is the red zone, the trauma zone, and that's where there's meltdown, can't function, shut down, run away. So those are the levels of stress I want to teach my patients. Pain levels, I start with level 1 pain and give a brief verbal description of each of the 10 levels. For example, when my pain level's at level 1, it's barely noticeable. Sometimes I don't even notice it's there. At level 2, it's a bit more noticeable, but it's no big deal. At level 3, now it's starting to really make its presence known. I'm aware of it most of the time, but it's still not a big deal. And it doesn't impact my thoughts or my feelings or my behaviors. At level 4, now it's starting to become a little bit of a big deal. And my thinking changes, my emotions start changing a little bit. I'm still able to keep going and having no coping problems. At level 5, now this is where I start having a little bit of difficulty with regular day-to-day coping, but I'm still getting everything done. It's just taking extra effort. When my pain gets to level 6, now there's a little bit of distress and it's starting to impair my ability to get certain things done. And at level 7, the distress gets worse and my ability to function also decreases. And then at level 8, both of those get much worse, where at level 9, I just want to give up, pull the covers up, and go to bed. And at level 10 is the shutdown. So teaching patients how to use verbal descriptors of the pain levels rather than asking them to circle a number on a scale is really important. And teaching people the correlation between stress and pain is also very important. I'm hoping some of you find this helpful. I know many of my patients do, and it helps our communication go much better. And remember, I believe that freedom from suffering is everyone's right, but it's also their responsibility. And I believe it's my responsibility as a healthcare provider to help educate my patients and how to obtain their own personal freedom from suffering.